Good morning, everybody. We're back. This is Marlene Yvette again, going over Mariah Saray Yvette's Children's Health Plano Legacy records, the hospital visit records from February 24th, 2016, when she was returned from 2 weeks alleged quote-unquote makeup visits on the illegal void order in the matter of the marriage of the 470th District Court, Collin County, Texas, Judge Emily Miskell presiding. I was going over her medical records, her before report that I didn't even know existed, but God showed me it did. That was a complete physical examination of her before she came home, and also just confirming that there was nothing wrong with her when I dropped her off to Dad, but of course the things that were terribly wrong when she came back. So I'm going to go ahead and try to go through this briefly. It's early morning, she's still sleeping, and it's a lot easier to record when she's not trying to grab the recorder and tripod stick from me, so I'm going to try to go through this pretty quickly. If I'm moving too fast, hopefully you can understand just the time constraints. Also, just want to say God has been doing amazing things, and just the angels He's sending all day, every day, just is blowing my mind. I was just saying to one yesterday that you know, even though I didn't know that I was going to have to go away for a time, God did. He wasn't surprised by it. And, you know, He's helped people before. It's not the first time He's done this. Many stories in the Bible. Think about Rahab and the spies, and just so many various different people that He loved, that He protected, and that He said it's time to kind of go on the run for a little bit. And so it's just amazing to be walking that out in 2016 in mysterious ways. Can't even go through all the details, but I'm looking forward to sharing the story. So again, without further ado, I'm going to go ahead and hurry up and get done. So if you remember in the previous video, this is the original records request that I filled out on March 24th. They're at the hospital there in Plano, walking in with her. This is showing the what is my chart, and this was the actual folder that they presented the records, which was just the lab reports I requested from 224 and 225. That's because we actually went into the ER. We waited for probably about an hour and a half before we were seen, somewhere around 11 in the 11th hour, or I guess military time, the 23rd hour, and then our discharge was actually around 12:30 in the morning on the 25th. So I requested the records for the 24th and the 25th, and so they actually delivered them in this. This is, of course, the name tag that I received when I was there. Again, this was Welcome to Children's Medical Center portal. That was done on Thursday, March 24, 2016 at 2:55 p.m. Again, the next one was showing, next one come over here. It's showing Welcome to Children's Medical Center patient records here. Again, to my former email address, ourfreedom2015@yahoo.com, March 24, 2016, 3:03 p.m. And again, it's saying your request to access patient medical records from Children's Medical Center has been completed. In order to access the information, please sign in to the children's website at https://onlinechildrens.com. Thank you again, Children's Medical Center. This message was created by an automated system. Please not reply. So then we went over to the next page, which is download records, and you can see that this actually did not occur until March 28, 2016. So it's showing download records. There's my daughter's name, Mariah, page 1 of 1. Now we're going to go to immediately, I went through yesterday, if you remember, I went through all of the various different records that she's had with Children's Medical Center, their dates there, and then I started going through the records from February 24th when she returned from her father, sadly with a swollen vagina and fluids coming out of her, as well as very alarming responses to just light touch and trying to wash and bathe her like normal, and even the ER doctor trying to approach her to take her clothes off, the terror that was in her eyes. And so again, when you look at the warning signs of sexual abuse in toddlers, way too many signs for comfort. Of course, as you've seen other videos, you have heard how 7 individuals, 6 full intentionally knowing, 1, unfortunately, as directed by our superiors, kept out the filing of a temporary restraining order with evidences from February 22nd, 2006 to March 2nd, 2016. So that was 10 days. I'm going to go over the emails that I sent to Mallory Maddox, court coordinator of the 470th District Court, that's been working in collusion with her judge. Apparently she's her former paralegal. And again, they've got their system of making sure whatever truth they want on the record gets in, and or fabricated and or perjured, and of course the actual true facts and evidence, making sure they stay off the record. And so that's what they instructed, that's what they did, and so that's the other thing that makes me very, very suspicious, and of course what we're going to go over right now. So more than suspicious, confirmed in why they were fighting so hard to keep the records out from being displayed before the motion to enter hearing on March 2nd, 2016, although they said Mallory said anything that was filed prior to the March 2nd motion to enter hearing would be heard, and so then they played the game of let's make sure she can't file it. So again, the criminals in that whole racket was Emily Miskell. A lot of people think that judges are immune, and the reality is when they step outside of their oath, okay, they are criminals just like you and I. They are not the honorable, they are not judge, they are in their first and last name criminals. And so the ones that participated in that was Emily Miskell of the 478 District Court, again her former paralegal, now court coordinator Mallory Maddox, her bailiff Christopher Lee, intentional, full, well-knowing Cindy Watson by phone giving instructions to Zonia Minjarez based on Zonia Minjarez's representations, and Stephen Janway. The three of those are district clerk supervisors in the Collin County Courthouse. Cindy Watson was Judge Chris Oldner's former court coordinator, and definitely many, many issues with her as well that I'll go over, many, many issues with Zonia. And the bottom line is that the integrity of the district clerk's office that receives all the filings and processes everything that happens from a court administration standpoint in Collin County is corrupt, then we have all kinds of cases that are not turning out the way that they're supposed to. We have, again, unsealed records, or we have sealed records in cases that should not be sealed. We have service returns of people that were subpoenaed to be in court and witnesses that didn't show up that now can't be held in contempt because, of course, people like Zonia Minjarez say, we're not filing it. Even though a third-party process serving company clearly filed the envelope, we're just not opening it. And so, again, there are so many various different battles I've had to fight over the past 3 years, fighting for my son and my baby girl. And ultimately all that's going to be exposed right now. So I'm going to go ahead and get back to what we're doing at this point, which is going over her records. And so now we are actually, we started, I think this is the beginning page as it is, so I'm starting from the beginning. I know I'd done some of this yesterday before she came to join me, so we're going to go ahead and go to 2/24/2016 and 2/25/2016. One of the things I want to make sure that I state, one of the reasons I'm having to do this myself is I know a lot of times mainstream media kind of has a silent gag order on them from exposing certain things of certain caliber. Like, for instance, if you have 7 to 9 cooperating judges, 3 county police departments, Child Protective Services, Child Advocacy Center, Child Abuse Task Force, court coordinators, bailiffs, court clerks, when you have that level of corruption that's about to be exposed, if you are a reporter in that region and you're the one to break that story and throw all that evidence out there, then you got to worry about not only your physical safety but also your professional career and just retaliation. And so I do get all of those reporters there in the Dallas-Fort Worth area. If there are those of you that are seeing these recordings and you do want to get a hold of me, then simply make a comment on the YouTube channel and I will contact you. There will be questions that I'll have to kind of vet that you really truly want to help and are not just simply trying to discover our location. But ultimately, we got to understand in 2016, while everything is now online and the world is kind of connected very easily, and that's a benefit for our powers that be to better track, better monitor, better silence. It's also a benefit for the people because it means we can get our word out, we can get our stories told, we can get our voices heard, whether they agree to post the stories or not. And so one thing that I'm hoping others are encouraged to do, I am not checking any case information on my case. They had a responsibility to e-serve me everything they were filing, and of course they have continued to not do that. Whenever they're trying to take adverse actions against me and my children, they make sure that they don't e-serve me. And there's going to be emails again, you'll see, secret e-serve filings, please file me, or please serve me, please let me know what you're filing. They don't want to do that because they know that Marlene Yvette would get her evidences, she would prepare, she would show up in court, and so they have to do it under the table. It's a really sad day when you are the powers that be and everything you do has to cheat, has to be in secret, has to be in silence. And so ultimately they had opportunities to serve me with things. They didn't serve me with things. Things went the way that they went. Before I had to move a little bit further from town and where they were trying to find me, so that I could get the story out. I contacted the courthouse to try to figure out how to handle the $383 failure to appear warrant that was issued while they knew I was 10 minutes away in the medical center of McKinney with my son, who just had a totaling accident where 2 airbags were deployed, where he had injured his arm and his hand, and again, it just totaled his vehicle. So I also had a witness there, a lady named Susie, that they swore in when she showed the pictures, and simply communicated as I text her and others on my phone to request a reset court date so I can show cause as to why no, I'm not sending her back to her father, Curry Johnson. Instead, Ken Harder, one of the most corrupt attorneys I've ever come across out of Carrollton, Texas, doesn't abide by the law whatsoever, not local rules, not Texas Rules of Civil Procedure, not the family code, nothing. He started whining, crying, complaining, saying that I had an excuse every time there's court, and actually I don't. So I will show the proof that actually this is an attorney that routinely failed to appear for major hearings, that routinely show up late. And so ultimately with that, because Judge Miskell, or Emily Miskell, already had a plan with the rest of the Collin County judges that they all have each other's back, of course immediately they issued a failure to appear warrant. Multiple people saw it online. A bond company was actually spoken with to confirm it was somewhere around $383 the day they issued it. And of course the next morning, once I have the money, all of a sudden it doesn't have an amount. All of a sudden I call the district clerk's office and they have to speak to 3 or 4 different people. They advise me I just have to go to the jail and find out what's going on. And so of course that makes no sense. You'll also hear audio with Collin County Bond Company being named as the bond company that was spoken to, again by Susie, to try to get details, as we were all trying to figure out how to lawfully handle this, but of course them unlawfully and illegally simply trying to get my body so that they can silence me, get all my evidence. They would not give information for me to find out how an attorney or myself could pay the failure to appear for being in the hospital with my son after just having a totaling accident 10 minutes away from the courthouse. That's what the failure to appear was for, and now they couldn't even see what the charge was. Again, you'll hear that on audio. The bond person, very seasoned, older gentleman, very confused as what's her charge, what's going on, we don't really understand, doesn't make sense. Tell the judge to set it aside. The next day, or I should say, I guess this was Thursday morning, and speaking to get that information, of course, again, calling the Collin County District Clerk's office, speaking with them, then being told the only person that can tell me is Mallory Maddox, of course, leaving a voicemail, her never contacting me back on that day to tell me anything, or emailing me, or e-serving like I asked, a reset court date for 1:30 or any other time. They never cared to. And so again, that's when God told me, unfortunately, these people do not want voluntary repentance. They want involuntary sentencing and exposure, and so that's what we're going to continue to go over here. So, HPI comments on date of service 2/24, 11:40 p.m. That's when they finally start to see us. It says 23-month-old female with I think it's a patient medical history, heart murmur. I'm just going to say PHMX. I'm not a doctor or a nurse, so I don't know. Heart murmur, presents to the emergency department. CO with diaper rash, onset 2 weeks ago. Mother reports vaginal ERYTHEMA and vaginal discharge. According to mother, patient was with father for the past 2 weeks. Location unknown to mother. Again, for those of you that saw the recordings, that reference to the fact that on February 21st, while he still had her, he stopped responding at all via email, text, anything to me, just simply inquiring how she was doing and to please give us an update. And so then I went to his residence there in the colony. He never opened the door for the colony police officers. He contacted them back and actually lied. I do have a police report on that. I'll read that later. And then I went over to Dallas to his mother's home, so my daughter's paternal grandmother's home, and she didn't know where he or the baby was, and this was early Sunday morning. So again, where is my daughter sleeping? That's a question that everybody should be able to answer. That's one actually that they're trying to assert is a problem with the environment, alleging that we live in a hotel with other people. He just found out. Again, translation, we do live in an extended stay. If you see on their sign, it's considered residence. They refer to themselves as apartments. There are people that live there 8 years, 5 years, 15 years, you know. The only difference is you don't have to get approval and qualification like you would a normal apartment or home. People literally get satellites set up. We do sign lease agreements. They do have to evict you in order to put you out once you've been there for over 30 days, and so it is a different setup. Again, 2 fully furnished bedrooms, full living room, full kitchen, full bathroom, and again, she's living there with her mother. her big brother part-time with her youngest brother. And so again, it's not living in a hotel with people, it's living with her mother and one brother full-time in an extended stay residence, where again there's so many children that buses pick up and drop off every day, and people don't lose their kids for living there. So again, just to show how desperate they are to find things against me, it said location unknown to mother. That's where that came from, is the 9 a.m. to 12:40 p.m. unresolved by the Colony PD, by Dallas PD, where he could not simply present her to law enforcement to see that she was okay, safe, and well, but finally apparently showed her to Officer Hogan of the Dallas Police Department Northeast Substation via FaceTime. So that's why it says location unknown to mother. So it says mother took pictures of patient's genital area prior to stay with father, and states patient's diaper area is much more swollen and red. Mother concerned that that child's reaction to taking off clothes may indicate something happened with father or whomever she was with. Vaccinations are up to date. Mother has a history of blood disorder, and father has a history of kidney disease. NKDA, no recent travel, no sick contacts. I want to talk about this blood condition for just a moment, because ultimately they would look for a great reason to say that I passed. What this blood condition was when I was 18 years old, having my third child, which was Joshua. I had a gestational blood clot in my left leg. I am now 36 years old, about to be 37. I have never required any treatment from a doctor with regards to my blood condition. They treat my pregnancies as high risk because your risk increases when you're pregnant. Yes, of clotting just naturally anyways, as well as things like gestational diabetes. And so I was treated with blood thinners and treated as a high-risk patient because of those conditions, as well as a couple of miscarriages. But again, this blood condition, the resolve for it would be a few aspirins a day, which I've never taken since 18 years old. Again, we're talking about almost 20 years later. And so this is not something like, oh, she had a medical condition and that's probably what happened to her. I'm alive, I am well, I'm doing great. And again, that was 20 years ago. So I know that we've got another pending medical examination report out of Collin County. I know the insinuation that things could possibly not be as police report, even though their reports already with the condition of the 3 found children in McKinney are already contradictory. I know there's a lot of people that are really upset right now, and you want to defend your police departments there in Collin County, that they could never lie. And of course, based on whatever they say, that's the truth. I know that it's been said that it might be several weeks before we get the report, but there's other things that anyone that just studies different family dynamics like domestic violence, they said she'd have to often cancel various different things. They understand a lot of those. Just on one side, as one possibility, would be indicative with someone that once they receive a bruise, maybe a black eye, things of that nature, they got to cancel, or they got to show up and expose their husband, which for those of us that have been in Christian marriages, you don't expose your husband, you pray, you change your behavior, you submit. These are all the different advisements that you get from many churches, and you just cover it up. I talked with a pastor of a very, very large church there in Penal recently, and he talked about how he's counseling a woman that was in an abusive marriage for 20 years. Again, for many, many women, that's about the course that it runs before finally we say it's enough. And so ultimately, again, I'm not saying that's exactly what happened. I'm not trying to play CSI detective. I know there's going to be people that dispute this and really are frustrated at even the notion. But again, I think there should be more people frustrated at the notion that you have a 1, 3, 5-year-old and a wife who's left their phone at home. They're gone for days and you don't even report it. Yeah, he didn't know. But again, there's so much that doesn't make sense. Like, again, how that 1, 3, and 5-year-old sit in a car unnoticed in that massive, busy shopping strip for days. And then, oh, look here, on Thursday, they're found. And they're slightly dehydrated and doing well. But then a few days later, once they realize, oops, we messed up, that doesn't make sense. Now they're severely dehydrated, as they should be. And by the way, the baby's in critical condition. So ultimately, there's so much to share and just talk about, but I want to go ahead and get back to the report. So, no sick contacts. I had to go ahead and address that whole blood clot situation. So now we're going to go ahead and go to patient is a 23-month-old female presenting with rash, history provided by mother, language interpreter used no, rash, location, anogenital, quality, redness, and swelling. Now, this part of the report They talked about what mother reported, and if you remember in the doctor's records from Inwood Village Pediatrics, again, they're very clear to talk about with patient presents with dad reports, or patient reports, meaning dad. But then they also make a determination on what the physician actually saw and found. And so this portion here is now going over what she has found and putting in her notes. Anogenital, quality, redness and swelling, severity, moderate. I don't know all the various different severity levels. I was told by someone that that is not even the lowest level, but that's a little bit higher in the scale, which is what was going on. Obviously, I'm not going to post pictures of my daughter's 23-month-old vaginal area online, but those are available to see the difference of before and after. And of course, that's all I wanted to be able to show the judge. But of course, we have to engineer the fraud of this case, because we've already decided the father gets the baby, and we're going to work him into getting full custody. And if we can, we're going to try to figure out a way to go ahead and get her thrown in jail. So of course, we don't want anyone getting confused with the facts. So now we're going to go ahead and talk about progression unchanged. Various different things, and you can read them here. So I'm just going to say no diarrhea, no fever, no sore throat, not vomiting, and not wheezing. Intake amount, eating and drinking normally, which by the way I had gotten her to finally before she started going all the way in February. But she was still choosing to breastfeed as she is now. One of the other videos that I've made, I think I might have mentioned that she literally during those 2 weeks, my milk dried up. I tried to pump, it didn't work. And when she came back emotionally, obviously it was upsetting to her because she would latch on for hours, very painful. And for 2 weeks she sucked until literally my milk came back. And so, again, breastfeeding, please do your research. I think the World Health Organization says the average worldwide is 3 to 5 years old. I know here in the US we would think that that's crazy to breastfeed that long. To those that breastfeed the natural way, I tell you, keep going. We definitely know and see the benefits for our children. And so don't let anybody, impose upon you what's best for you or your children. It also says breastfed children, they have very high IQ levels, and a lot of them have a greater sense of independence when they get to make the choice to wean when they're ready. I breastfed all of my children. She has been the longest, but obviously she was not ready physically and or emotionally to break that bond, even though Emily Miskell, as inconsiderate and even abusing her discretion, didn't care about and ripped her away from her breastfeeding mother completely for 2 weeks. No interventions, no ability to even let me drive back and forth and waste my time and gas. Mariah had a different opinion, and so ultimately, while they'll try to make it, all we needed to do was just rip her away and force feed her. Nope, I was working on it all along. I mentioned that to them, and again, regardless of how they tried to paint it, it was just ugly and wrong. Printed on 3/24, 3:05 p.m. Again, this was the after doctor's report. We're going to go ahead and go to the next page here, which is just simply, just talking about the history, maternal and paternal history here. Now we're going to go ahead and go to the MDM, number of diagnoses or management options, where it says the only one is diaper dermatitis. The plan is to consult social work, which they did. I've actually got an audio of that. Unfortunately, that social worker's advice was it's very invasive. We shouldn't go through that procedure. You're right, they could use it against you. All I would have to do is pull the medical reports as attorney. And so again, as many of you know, when you make allegations of child sexual abuse in the confines of custody situations, you have people all the way from the medical doctors to the custody evaluators to the judge and all their cronies, making sure that they disbelieve you, making sure that they criminalize you. Many have lost their children for trying to protect them against child sexual abuse, and it just gets passed under the rug, and it's just sick, the amount of child pedophilia that we're allowing through our court systems, through our child protective service systems, and not wanting to give people the opportunity to do what I'm doing right now, which is to simply present the evidence. So again, I'm doing it. God had a different plan. Sorry, 470th and company. Plan of social work, gram stain and culture of vaginal swab. This is very, very important. Gram stain and culture of vaginal swab. This is going to be very important. Please pay attention. Perhaps one of the most important issues that we have. Why so much secrecy? Why is Children's Hospital lying in their own medical records? Plan of care at home. Includes frequent diaper changes, like I always did, sits bads, and over-the-counter hydrocortisone 1%. Now, it says labs, no results found for this visit on 2/24/16, which means they hadn't come back yet. Diagnosis, no diagnosis found. Now, I'd already gone over the paperwork that I had gotten, which was diaper dermatitis when we left the hospital. Disposition is discharge. That means sending us home, not the same kind of discharge that was coming out of her. So it says follow-up is RTR, warnings given for any new or worsening signs or symptoms. Parents have understand and agree with plan for discharge. All questions asked and addressed. I, Nehemiah, I can't pronounce that last name, I apologize. I'm scribing for and in the presence of another doctor whose name I can't pronounce. At 11:35 p.m. Documentation assistance provided for Nehemiah, MD, by the following scribe, Nehemiah. Information recorded by the scribe was done at my direction, has been reviewed and validated by me on 2/24 at 11:35 p.m. Am I even showing that right now as I'm reading? Oh, here it is. Very hard to record and read at the same time. Oh, just flew that paper. 1 second. So now we're going to go to some additional notes. Patient AO appropriate. No obvious pain or distress. Per mom, patient returned from other parent, diaper rash, and unknown discharge. Mother concerned for possible issues. States area is considerably more swollen than when left. Electronically signed by Tony Dunford, RN 2/24/2016 at 11:40 p.m. Mariah Surrey, that is 23-month-old female. Patient presents with diaper rash. Just picked patient up after spending time with dad for 2 weeks. Extremely raw per mom and would also like patient to be looked at to make sure nothing else has happened. To Plano ER on 2/24/2016. These are progress notes by Jamie Tweedle, 2/25/2016 at 9:52 a.m. A little bit concerned, or not sure how that happened at that particular time, but I'm going to go ahead and go through past medical history, heart murmur, medications in ER, none, no known allergies, lost recorded weight, discharge diagnosis on 2/24, diaper dermatitis. Of course, we actually didn't discharge till 2/25. Discharge prescription on 2/24/2016 is none. Current outpatient prescriptions, acetaminophen, Tylenol. Take 4.8 milliliters by mouth. Every 4 hours is needed. Recommendation: await final wound culture results and susceptibilities. We're going to talk about this here just in a minute. We saw obviously vaginal culture, now we see wound culture. So again, I'm not really understanding where this is coming from, but Jamie Tweedle, Pharm, RPH, ER clinical pharmacist, Children's Medical Center. Now we've got another author, Antoncio Mercado. A lot of people at Children's Hospital that touch these records. So again, we're going to look at Children's Health Dallas, ER clinical pharmacist, await final wound culture report and susceptibilities. Okay? Await final wound culture report and susceptibilities. No changes to treatment are recommended based on final wound culture. Now this is progress notes by this person on 2/28/2016, 12:38 p.m. Now, problem here, now we're going to talk about that wound culture. That does say abnormal. So this is the results, final results. Okay. It says specimen information type other, wound, source, wound. Now, for those of you that are already in medical professions, you understand that typically a vagina is not considered a wound. Typically a vagina is considered a vagina. I didn't know this at first, but I did my further research because I did not want to make any bogus allegations, just simply out of ignorance. And so I'm just going to read the other things that they found here. Result: PMNs / WBCs, rare, squamous. Okay, I'm hearing her moving, so I'm going to move faster. but it says the final report is moderate growth, Staphylococcus aureus, oxacillin sensitive. Okay, so what I'm going to do, or what I did, was I actually looked online to see what that was, and it was described as the most serious, most dangerous type of staph infection. Now, I'm confused because I don't really know how you get a staph infection that materializes as discharge coming out of a vagina, but what I read about that staph infection is that, again, the most dangerous type needs to be treated. Penicillin, antibiotics, I think I even read some things that stated that there might be some quarantining that takes place for a person that has something like this, and so don't have much history with staph infections. I don't know if I've ever had any, or even my children have had any, but again, it says that it is actually transferred by direct skin-to-skin contact. If you remember one of the previous records talking about diaper dermatitis, that it's not transferred through skin-to-skin contact. So now we have something that is, but why do we have massive from the labia and inner thigh and the vagina for something that is direct contact from someone to the skin all over her vagina? No other area of her body. I don't understand. Why do we have Children's Hospital now saying that the results came from a wound, and by the way, not calling me? So now we've got contradictory alleged wound culture from the 2/24/16 with Concentra culture testing explanation. So again, I did my research. I didn't want to make any false, bogus allegations, but I was also wondering, why won't his attorney simply get the medical reports that say she just had a diaper dermatitis and allow it to be heard in court? What is everybody hiding? What is everybody so afraid of to not let me have that heard? Well, if you never asked, so go and talk to Google. I went to Google and I found Concentra, which apparently is one of the largest labs in the US. So I'm going to show you where this source is coming from. 2016 Concentra Operating Corporation, all rights reserved. Now, it would have been nice to actually get results from either Children's Hospital to contact me and say, your daughter has the most dangerous type of staph infection, she needs to be treated. It would have been nice to get a call from her doctors there at Inwood Village Pediatrics, where one of the doctors is on the board of Children's Hospital Medical Trust, but I didn't get that. So for all of you that are being critical and don't understand, well, why didn't she simply ask professionals and medical doctors? For some reason, they all didn't want to talk to me and tell me the results of my daughter's labs. Again, it was not until a month later, actually to the day, that I finally had the strength to go and get what I never wanted to get, which is if I go to Children's Hospital and I look for lab results and they try to say that they did not take anything from my daughter's vagina, right? Because if you also remember from a previous recording, I mentioned how at the end of our discharge appointment, I had to tell our male nurse, they took the swab from my daughter's vagina, but it's still sitting on the counter. Can you make sure it gets to the lab? I was afraid that ultimately if I go to look for a vagina culture and it's not there, then it's obviously a reason why they're not admitting that what they took out of her vagina came from her vagina, and I didn't want that confirmation, but sadly I had to go ahead and get it anyways. So culture testing, they're talking about the various different type of detect and identify infections with our culture testing, right? And so I wanted to know, is it possible that maybe medical science calls a vagina a wound? So I went down the list of all the different types of culture testing. It says, what is a culture test, right? So it goes through and it gives their explanation of what is a culture test. A culture is a sample of tissue or fluid taken from the body that can be evaluated in the laboratory to detect and identify infections as well as determine sensitivity to antibiotics. Cultures are obtained to assist the provider in determining the type of infection and directing the antibiotic choice. The result from cultures usually take 48 to 72 hours, during the time the provider may choose to treat based on the location, mechanism of injury, or area of body pending the results. Some of the culture tests available at Concentra include, now it's going to go down the list of all the different types of tests: throat culture, blood culture, sputum culture, vaginal swabs and cultures. If you remember in the records that we showed just before, it was going over that it was a vaginal swab. Those are the language that they used. Let's look what comes next. Skin and wound culture. Again, I want to go back for anyone who may have missed it. Vaginal swabs and cultures. Skin and wound culture. Are they a separate category? Looks like it. So again, to those of us that are laymen and we don't have any type of medical background and degree, it looks like when a culture is taken from a vagina, they say it's a vaginal swab and culture. When it's taken from a skin and wound, they say it's taken from skin and wound. And then they even talk about a pap smear test. So that's also from a vagina, but it's very specific. Again, this printed out by me, by www.concentra.com/patient/health/-library/lab cultures. And again, this was 3/28/2016. Houston, we have a problem. Children's Medical Center, Plano. Why are we referring to the fluid that you took out of my daughter as a wound culture, not calling about it to treat it, when the reality is clearly, even in your own records, it was a vaginal culture? And then, of course, there's the audio that we're going to talk about and release later here soon. Now let's talk about something else where it says all Texas hospitals required to collect sexual assault evidence. This apparently was done by Laura Hines, August 26, 2013, updated August 27, 2013, 10:03 a.m. Okay. It says police and prosecutors soon will have additional help in their hunt for rapists. Okay. Houston area healthcare providers say a new law requiring all Texas hospitals with emergency rooms to collect evidence from sexual assault victims could make it easier for rape victims to pursue criminal cases. Okay? The new law, which received overwhelming support in the Texas, well, this was printed out on 3/29, again, trying to figure out, did the hospital have a responsibility to keep and collect anything? The new law, which received overwhelming support in the Texas House, was unanimously passed in the Senate, goes into effect September 1st. It mandates hospitals with emergency rooms to have doctors and nurses trained in basic forensic evidence collection for rape kits. The law also requires patients have the choice to go to facilities with sexual assault nurse examiners, what they call SANE nurses. It says one facility per town. Collection of forensic evidence has increasingly been in the spotlight. Okay? Go ahead if you want to read this article. It was done again by the Houston Chronicle. News Health article. All Texas hospitals required to collect. Okay. Oh, here's the other problem we have here. Now we're going to talk about... Now this is Texas Children's Hospital. Again, I made sure I did further research. I actually talked to a medical malpractice law firm, not because I'm interested in filing suit with Children's Hospital, although with their complicity in the situation, that probably will likely happen. But that wasn't my most important interest in talking to that law firm. My most important interest was to simply go over the results and check it with an attorney to see what was out of sorts before I went into court to show cause that day. I actually was talking with an attorney that morning to just check and make sure all of my research that I spent plenty of time before I made any direct assumptions or allegations was correct, so that I could stand corrected if I was incorrect. And unfortunately, I didn't get that what I was looking at was incorrect. Now we're going to look at TexasCriminalDefenseLawyers.com, SANE Nurses Investigative Protocol. Again, this was only printed on 3/30, which was actually the date of my show cause hearing, which I was coming to bring all of this evidence. SANE Nurses Investigative Protocol, Defense Techniques in the Courtroom. This was done by Ned Barnett, Stanley G. Snyder, and Dr. Stacy Mitchell, defending sexual assault involving children, September 11th through 12th, 2008, Austin, Texas, Law Office of Ned Barrett, Houston, Texas, and Stanley Schneider of Houston, Texas, Dr. Stacy Mitchell. This is 14 of 31 pages. It talks about collection procedures. Again, it is something that hospitals, it talks about swabs and smears, are supposed to be up to date with, and you would think a hospital like Children's Hospital obviously would be up to date with that. You would hope and pray. Law enforcement investigative interviews. Now it talks about child protocol. Sexual abuse of a child by a family member, caretaker, or other person known to the child. Sexual abuse of a child by using pornographic materials and exploitation. Sexual assault, sexual abuse of a child by a stranger, many times involving kidnapping and or the use of a weapon. Okay, And it just talks about various different information. Again, you can look this up. This is under SANE Nurses Investigative Protocol, Schneider and McKinney PC. Again, this was done on 3/30/2016 that I printed it. It also is going to talk about reporting. So this is very important that we all know this. Texas Law Family Code Section 34.01, amended in 1987, states that any person having cause to believe that a child's physical or mental health or welfare has been adversely affected by abuse or neglect by a person responsible for the child's care, custody, or welfare shall report, doesn't say may, doesn't say can, shall report in accordance with Section 34.02 of this code. Hospital did not have the option to not report it and move forward with the collection, as you'll hear on the audio and you could even see in the reports. I'm not making direct allegations, the last thing I want to confirm, but I was concerned, and so I did report it to, again, medical professionals that could get the evidence of my daughter and be able to see what's happened. So again, this is going into another article about DNA forensic testing and use of DNA rape kits in cases of rape and sexual assault. Apparently this was done Monday, January 26, 2015 at 8:21 a.m. by Carl M. McDonald. This was under forensicmag.com, articles 2015-01 DNA forensic testing and our DNA rape kits. That was actually pulled on 3/28/2016. So again, I went to great lengths to make sure that I got information before I just went and made allegations. But ultimately, I have a legal responsibility just as much as any parent, even if you're not the one that's abusing the child. If you know the other parent is abusing, you do have to report, you do have to treat your child, you do have to get information to find out what's going on. And so, again, this is the Texas Penal Code, offenses against the person. Talks about sexual offenses. And I'm being interrupted here, so I'm going to go ahead and stop here for now, and then we're going to come back to it. This is Marlene Yvette.